as an emerging capital of diabetes. We should not become the emerging capital of diabetes, but we should become a diabetes care capital of the world. We have huge manpower available with us. Only the thing is there is a need to tweak them, there is a need to give them the skills, and so that they can able to manage such type of disease managements into their own areas. You don't have to come to the metros. At your own village you can do that. We started a first initiative to bring the capacity of physicians known as Certificate Course in Evidence-Based Diabetes Management, which is a purely a public-private partnership model where the PHFI has joined hands with a strong academic partner based at Chennai, Dr. Mohan Diabetes Academy, and we got the education grant from MST. And this model has become the flagship course in the country now, and this is the only model in the globe which got the IDF recognition. International Diabetes Federation has come over to India. There is no need to go out from India. I'm always saying come here, as sir has already said, that diamonds to hain par dhool mein hai. Sir, usko dhoond lo to sab kaam ho sakta hai. So India mein diamonds are available. We just have to make them come out and to do the things in the right way. We started another course known as Gestational Diabetes. Then we started a course known as Advanced Course in Prevention and Management of Diabetes and Cardiovascular Diseases. Then we started a course on thyroid disorders. Now there is a course which we are going to start on diabetic retinopathy. These all courses are to upping the capacity of primary care physicians. Our focus is on primary care physicians itself. Why I'm saying this? If you see the specialist level endocrinologists, hardly 40 endocrinologists per year, they are coming out from the various medical colleges per year. So majority of 70% of the population are still going to the primary care physicians. Until unless you don't build up their skills, you're not going to get the right way of the treatment from them. It's a course which is a 12-modular course, once in a month, at your own place on a weekend. You don't have to go through all the 12 days. Once in a month, any doctor can afford 5 to 6 hours. This is a trick which we have played, and it worked out very well. Once in a month, 5 to 6 hours, anybody can go. As my previous panelist has said, there is a need to have interaction, because still India believes something should be there in books, something should be in handy, and something should be interactive. That's what this model is playing a big role. We have selected the top-notch endocrinologists and cardiologists of the country. They are acting as a faculty, and they are imparting the teaching on the standardized course modules prepared by none other than but the panel of the 15 national experts, those who are top-notch all across country, along with Dr. Mohan Diabetes Academy. Just see the scale. In the first year, we have trained 1,208 doctors. In the second year, 1,568. In the third year, 2,306. And this is the fourth cycle of this course is going on, and we have trained more than 2,350 doctors. In case, if you total all this, more than 7,500 doctors have already been trained into this evidence-based diabetes management course. This is a panel of national experts, who in the field of endocrinology: Dr. Amrish Mittal, Dr. Nikhil Tandon from All India Institute, Dr. Wangnu, Dr. Anil Bhansali, Dr. Sarita Bajaj, Dr. Shashank Joshi, Dr. R. Vijay Kumar, Dr. Vijay Vishwanathan, Dr. A.K. Das, Dr. Bipin Sethi. They are the people, those who are putting their efforts in finalizing the course curriculum after getting from the Dr. Mohan Diabetes Academy. Other than that, they are also updating the curriculum based upon the feedbacks which we are getting regularly from various participants when we are sending our observers to the different centers. If you see the scale, the average experience of these physicians, more than 13 years clinical experience. If you see the doctors are not coming only from the private sector, people are coming from the government sector also. People are coming from the BHEL, various PHUs, CGHS, ESI. So people are joining, and people are getting their evidence-based diabetes management guidelines, as well as the portfolio, how to manage the diabetes management into their own clinics. This is the scale. Just see from Jammu to Kerala, we have centers all across country. You don't have to come. There are places like Kakinada, Kumbakonam, Nagarkoil. People are getting the training from those places only. If you see Jaipur itself, we are having 4 centers. In NCR region itself, we are having around 10 centers. So this is the scale of the program, with 162 faculty all across country, 130 centers, and this is the way which we are imparting the teaching. This was the day when the IDF President Sir Michael Hurst came over to Delhi, and he has declared that this is the first course in the globe which got the IDF recognition. So this is what India is doing. This is what we people are jointly doing, all these things. This is the certification which IDF has given to Public Health Foundation of India for excellence in providing the education in the diabetes management, and this is there for recognition, is there for 3 years. Last year, BMJ has started the first time in India BMJ Awards, and we applied for excellence in medical education category, and we got as a finalist BMJ Award in India itself. We do the evaluation because we believe until unless you don't evaluate yourself, you can't improvise yourself. So we do the evaluation of each and every cycle at the end of the courses. We are sending the observers on site to the different centers. They are giving us the feedback. And when we do the evaluation every year, we are getting a lot of feedbacks and we are improvising on that. Based upon this same model, we started a gestational diabetes course. Each center, 2 faculty, gynecologist and diabetologist, and they are imparting the teaching. Here the corporates have joined hands with us, and this is a joint model again. Here Johnson & Johnson is acting as an education grant partner for us, and we have trained more than 2,700 doctors in 3 years in the management of gestational diabetes itself. This is the accreditation which PHFI has received from South Asian Federation of Endocrine Society. They have accredited this model. Now this model we can implement in Nepal, Pakistan, Bangladesh and Bhutan. You can scale up and you can go there also. This is another course. People thought diabetes along with cardiac is needed, so we started another course, and this is advanced course in diabetes and cardiovascular disease management, and Abbott is acting as an education grant partner with us, and we got the technical partner is the World Heart Federation, and 7,756 doctors have done the training. This is thyroid, another initiative which is a thyroid course which we have started. So in all, if you see, we have created a benchmark in the country in the field of capacity building for primary care physicians, and we have done that. We have started the GIS mapping of our participants as well as our centers also. We have a strong monitoring mechanism by which we are doing the quality measures, and a lot of state governments have come up and they have adopted this model. This is the peculiarity, public-private partnership which we always talk about, PPP. Kerala government, MP government, Gujarat government, they are the governments, those who have taken up this model for the training of their physicians. They are based at PHCs and CHCs. So this is all from our side which PHFI is doing. A lot of media coverages had happened. This is a network which PHFI has created covering 150 cities all across country. This is a very huge model. These are our various international partners for this: International Red Cross Society, World Heart Federation, IDF, academic partner Dr. Mohan, Arvindai, Center for Chronic Disease Control, International Society of Hypertension, British Hypertension Society, various state governments as educational partner. This is in summarizing all these things. I can only say since last 5 years, more than 12,000 doctors trainings have been done in the evidence-based chronic conditions disease management. I would like to thank our President, Dr. K. Srinath Reddy, our Vice President, Dr. Prabhakaran, all stakeholders and team of 35 colleagues, those who are working round the clock for running such type of initiatives. And last words of our People's President, I want to say that excellence is not by accident, but it is a continuous process, and PHFI is working on that excellence to create a benchmark in the management of chronic disease management. Thank you.
Thank you. Thank you, Dr. Balla, for sharing this scare of lifestyle diseases with a focus on diabetes and what PHFI is doing to control the scourge through training of human resource, both at the professional as well as the frontline level. Now I'd like to invite Dr. Gogia for his presentation.
Thank you, Dr. Nagpal. First of all, I have to thank Mr. Rajendra Gupta for inviting me. In addition to what I was supposed to talk, this is based on what I told him in the morning of what I am presenting, and he said that this is important for this session also. So I would just like to know who all of you have attended the morning's talk. Most of you have, so then I don't need to go through it. You would have noticed in that we did talk a lot about requirement of skills in the very, very abs rural areas, and I'll just briefly go through that again for the people who could not attend. I don't want to go through the presentation. Basically, the largest gap in skills is in the rural areas. And if we want this country to continue growing, which China did long back, it was to reach out to the rural areas. Our urban areas are well developed, our rural areas are not. And we don't have jobs in the rural areas. Doctors who are trained out there don't want to go there. And not only because of this, there is also a gap in other facilities. Healthcare is not available because the trained doctors are not there. And okay, we brought out a solution of telemedicine. But I say, and it's just a conjectural feeling which is not, I can't quote from anywhere, I say telemedicine gives you half a doctor. It is very useful where there's no doctor. It is useless if there's a full doctor. So, I mean, if you look at a person who is staying in Delhi, you ask him to do telemedicine, he said, why, I can go to Max, no, I can get my treatment. But if he has to travel 3,000 miles or even 20 miles, and I've seen this happen, this is what actually inducted me into telemedicine, was I was in Mussoorie, and he was talking about Mussoorie at that time. I have a cottage out there, just by chance. And on taking a walk, I saw people carrying a person on a cot just to reach the road. And I said, if I can stop this even once, I've done something. And what is the reason? I say, I took the simple example of the dressing in my slide. A dressing costs you 20 rupees. But when he has to go to the town for that, it has already gone up to 2,000 rupees because the cost of transportation, a person has to come along with you. Now, if we can give the right dressing equipment, we can give the right drugs for doing the dressing, and more importantly, the knowledge of how to use those equipment and the drugs. And this is where the gap which telemedicine and IT can easily cover. So, again, let us not, I am a doctor, although I am a doctor, and a lot of people say that we should not, RMPs and quacks are to be degraded, and I don't think so. They are the people everybody will turn to at the time of need, because they are the what are called Andho mein Kana Raja, they are the Kanas. And we just develop the skills a little more, make them more than a Kana, and we have done wonders. So that is one thing which IT can easily do, because IT is basically knowledge and information management. Just transmit the knowledge across, make it possible. We have to create a support system so that then the knowledge, information through IT takes place on a continuous basis. You show him a patient and he says, no, you have not done this wrong. Next time you'll do it better. So that becomes a continuous process of learning, and it can be part of a skills development program. Our own projects, which Sathi is doing, the 3 projects that I showed you in the morning, all of them depended on trained workers in the rural areas who were trained further how to not only manage a problem to whatever they can, like for eye problem. They used to do the examination, they used to send the photographs across. After that, the stitch removal, glasses, everything was done locally. So instead of 5 trips, only 1 trip was required to the hospital for the surgery itself. So, but the training for making glasses we imparted to them, training of communicating through the IT and sending the photographs was imparted to them, and that 1 month training program took place for these people in Delhi. We brought them here, and now they've been working in Mizoram and giving remarkable results for the people out there. That is one part I want to talk to you. That is, there are other 2 important components of skills that I want to talk to you, which is over and above that talk. One is that one of the main chicken and egg situation which we have in healthcare IT in India is that there are not enough people trained in healthcare information technology. Me, I am supposed to be a HIT expert, but I have not had any formal training. And of course, IHMR, thanks to them, has started a course, and some of the students are sitting there, and but it's too few. We do need to develop HIT training across the country so that they can be the CIO officers and do this entire program that we're looking at, because they have to look at the networking, they have to look at the healthcare aspects to it. That is another aspect we have to look at. And regarding that, there is also no certification process for them. AICT is providing some of the training, but just for management. It's not for pure HIT. HIT training, fortunately, the biggest organization which does this training is called AHIMA, American Healthcare Informatics Management Association. And AHIMA is creating an India chapter. We are launching in October, and we are looking for partners who will do, they provide online courses, something like the MOOCs that he said. But they will require a physical component. They will also require the overseeing the examinations and all that. And any university which is interested, and we're already talking to IHMR, is interested to participate the physical component, as Mr. Krishan Girdhar very rightly said, is important for the Indian these things. We are willing to give them those things, and they can take over this. That is one information which I definitely wanted to give you. And these people are of all 6 levels of possible training, right from the basic data entry operator to up to CIO of a hospital. They're giving that sort of training. And the third thing that I wanted to talk to you in this session was using IT for skills development itself. And I'm now talking about a certain concept, and of course it's been mentioned a little while ago, that we have to give them additional training, just like, you know, how to take a BP and all that. You must remember that most training in medical careers has been through books so far. But certain important things, procedures, can only be taught through videos. There are, you know, webinars available. In fact, I myself, I'm a plastic surgeon. We have done complete transmission of surgical sessions, and we have had global people participating in that. And we have, the library has been created by the surgeon class. A lot of people have created these libraries, but getting them utilized, get them formalized. There's an organization called MedTech, which is providing video-based trainings and for the trained people itself on specific procedures, how to do a cleft lip. Or even for these you know, people who are working in the rural areas, for the nurses, how to take a BP, putting the thing. So that component also we need to look into, and definitely with the help of these, it will be a comprehensive development of healthcare, and besides it will help jobs reach everybody to this thing. And of course the diamond will come out. Thank you.
Thank you very much. Thank you, Dr. Gogia, for such a elaborate description of your efforts in skill development. And now we have the last speaker, and that's Mr. Rohit Kumar.
So, good afternoon, everyone. Thank you, Mr. Chairperson, sir, colleagues on the dais, friends in the audience, and colleagues I've worked with before. You know, about 5.5 years ago, I had the opportunity to meet Dr. Deka, who was the then director at All India Institute of Medical Sciences. And he asked me that time, he said, do you have something to solve for the rural market, for education or training in the rural market? And 5.5 years later, we're still sitting here, we're still debating, how do we solve this problem? Because the problem is huge, it's not an easy problem to solve. And that time there were very few smartphones. The iPhone had just sort of come out, 3GS had just come out. Very few people in India had smartphones. And now when you think about what is actually happening, and I'll share with you a few thought processes on why I actually left my job to do this. You know, so I started in January a company called Chapter Apps Incorporated, which is an angel-funded company domiciled in the US with the goal to actually make in India. And the co-founder is actually a Silicon Valley accelerator called Studio 9+, which is part of UWeb. And they're actually helping me build the product and build the software. Our mission is to help people learn better and become more effective by providing bite-sized content written for consumption on the mobile. So one big challenge today we have is that even if you put the same books available to read, other than an iPad, they're not that easy to read on a small screen for the mobile. And the second is to make this content affordable so the users only buy what they need. One of the discussion points that I was listening to, and we all were listening to, is obviously about IT training. What I'm trying to do is actually take away the need for that IT training so that every user can use what they need on their phone. There's no IT infrastructure involved. The only network is the 3G or the 4G network as it rolls out. So look at the global smartphone subscription growth. It's about 2.1 billion smartphones in the world, grew 23% in last year. In India, that number of growth was 55%, so more than double the global average of growth in smartphones. And where are these phones growing? They're actually growing all over. My driver came